Dr. Allison here. People experiencing pregnancy are going to notice increased flexibility in the joints, okay? So relaxin, progesterone, estrogen work together to increase the laxity of the joints in order for baby to be able to make its way through the pelvis during delivery. Well, that isn't always specific to just the pelvic joints. Those hormones affect other joints in our body as well. But what happens when we have that increased laxity, what I see clinically happen is that the pelvic floor reactively gets tighter and more shortened in order to provide stability for these pelvic joints. So this is pubic symphysis, and then we have your SI joints, sacroiliac joints. And in order to provide that stability, our pelvic floors often tighten, our glutes tighten, and that allows the body to live more pain-free, but can also cause issues like pubic bone pain and low back pain and SI pain. In order to prepare to push the baby out and to get the baby out of our body vaginally, we have to work on opening up the pelvic floor and training our muscles to be able to open in a healthy way. That can be hard if we are living our lives in a very shortened position. So if this is my pelvic floor, we want it to be able to relax and overstretch and to contract. And just doing Kegels or being recommended Kegels isn't necessarily the answer to being able to open and elongate our pelvic floor. So the best success that I see in our clinic is truly when we can overstretch these muscles, create balance of these muscles inside the pelvis and outside the pelvis, and train our breath to work with our pelvic floor opening. So when we go into labor, we can breathe our babies out. And this helps decrease the trauma to the whole perineum and to the pelvic floor, which means that you'll recover with a lot more ease and a lot less difficulty in the postpartum period. And when we have really healthy pelvic floors and perineums, our ability to have really good lives just increases exponentially. We end up not peeing our pants because our pelvic floors are working. Our pelvic floors are part of our deep core and they help absorb the forces from our joints. And so when it's working really well, we aren't gonna have things like low back pain, knee pain, sciatica, neck pain even. So it's really important that we work on learning how to breathe our babies out. So I have a workshop that I put together in order to teach the whole entire world how to breathe the babies out of our bodies. And it's really about connecting your breath to your pelvic floor. It is called The Secret to Decreasing Your Push Time, and I'm really excited to bring that today. So click the link and download it. Take care.